Here's the deal. For most people, losing weight is a sign of being healthy, of getting your life together, of taking control of yourself and eating right and exercising when and how society has told you that you're supposed to. Pro tip, society tells you a lot of untrue things. Now, I'm not going to talk about people with eating disorders because I don't know anything about them, so it's not my place to talk about it. I've never struggled with an eating disorder. What I do have are a couple of different and other issues. 1. I have Hashimoto's thyroiditis. Basically, my body hates my thyroid and attacks it, and my thyroid is confused by this, and sometimes produces way too much of the hormone the thyroid is supposed to produce, and then sometimes it makes none. This caused me to gain weight very quickly, despite not really eating much. I don't get hungry because of it, and I frequently forget to eat because I'm not hungry. It causes a lot of other issues, but since this is about weight, I'm not going to go into those. 2. I also have Crohn's disease. Now, it's the same as Hashimoto's, only in this one, my body hates my lower intestine and GI tract. All kinds of nasty things are happening down there, like fistulas and ulcers and sores. You name it, it's going on. It also means that my body can't process a lot of foods. Leafy fibrous vegetables, for one. I have trouble with greasy, oily fried foods, which sucks because I love fried foods. Processed sugars, gluten in excess. I'm pretty freaking limited on what I can and can't eat. And even if I watch what I eat, I still have occasional flare days, which leave me exhausted and in pain, and also mean I can't be too far from the bathroom. What does this have to do with weight loss? It's a good question, astute person. As I was saying, for most people, losing weight is a goal, and not a goal I agree with. I didn't always like my body, and in fact, I hated it a lot, but right around the time I started being cool with it and loving it, I started losing weight with no explanation, and went to the doctor, and got lots of blood drawn, and tubes with cameras shoved down my throat and up my butt until they could tell me what was wrong. So for me, losing weight is not a sign of improving health. Side note, rapid weight loss is never a sign of improving health. The weight I'm losing is not from exercise. It's not from a huge diet change, although my diet has changed significantly as I work out what my body can and can't handle. It's not because I suddenly love myself and want to take care of myself. It's because I'm sick. I'm pretty much dying by literal inches. My body uses up its fat stores to keep me alive. Now, this isn't a cry for pity or advice. I know what's going on with me, but I want you, people who listen to what I have to say, to know what's going on in my life, and understand that on one hand, I'm kind of happy I can see my feet again, but on the other hand, I know that losing weight isn't all good, and there's nothing I can do about it. I can only see it as a sign that I'm doing poorly in the health area. If I say to you, I'm losing weight, I probably don't want you to say, "Congratulations, what's your secret? You look awesome, I'm so happy for you." What I want is for you to respond in some sort of way that acknowledges what this means to me. Ask about my health and then move the hell on. Yes, you are. Are you doing okay? Have you seen the new video of the dog trying to eat a carrot? You're right. How's your health? Did you hear about the chick who dyed her armpit hair? Dude, did I show you this article about how aliens are trying to colonize anteater asses? Okay, maybe not that last one. My point here is twofold. 1, don't always assume that someone who is losing weight thinks that that's a good thing. 2, don't ever show me any articles about anteater asses.